Good morning, doctors. Recently, there was an interview of Armed Medical Corps on 5th of December. I hope the topics which I am giving you will based on that these topics are mandatory and you must prepare at least these topics. Other than that, what topics might be asked, I'll be discussing with you those topics also. And what my students have shared up with me about yesterday interview, I'm going to tell everything about that also. So first of all, what I get from other places, that topics I would like to tell you. Then I will discuss with you what my students have shared up about the interview panel, what you should do there. First and the foremost thing which I find in my students, they asked about introductory part. They asked about hobbies and prepare your hobbies in dynamic manner. They asked question based on that. Please don't ignore the hobbies which you have written over there while filling your forms and all that, because they asked about those hobbies also. If you change your hobbies, please don't forget to add on what you have written during your form filling. Now coming on the medical topics also, I'll be discussing these topics also. I suggest my students that as per the 5th of December interview, there were certain topics. I already told about your hobbies, about the family they asked. Even one student asked about the interview, but they cross question in between. Now that the questions of medical also, like they asked about the management of hypovolemic shock, I suggest my students treatment of epistaxis in hypertensive patients, dietary advice to pregnant women, treatment and management of acute chronic syndrome. So these topics I suggest. Moreover, मेरा ये मानना है दोस्तों that you should prepare regarding malarial treatment and dengue also, all mosquito based all diseases. You must know the name of mosquitoes also and their diseases also. Sometimes they ask like this. Other than that, there are questions based on classification of burns. I always suggest my students कि snake bite, burns, hernia, pancreatitis, ये topics आप अच्छे से करके जाइए. Mostly being asked, even jaundice, hernia, these questions. Then even देखिए आप ये देखिए, yesterday hernia question was asked, classification of burns was asked, and chronic liver diseases. Now that another question which was asked from board 1 was, what motivates you to join forces? So I think this is one of the important questions, or most of the time I'm even saying that medical officer work profile you must prepare in dynamic manner. Even I have given one short based on that also. You might have seen also. Here also yesterday it was asked that what is the MO responsibilities in PSC. Then limb trauma, ASHA full form. Then there was asked about the new name of HWC. Snakebite was asked almost 2 to 3 students even yesterday. Even hernia question was asked a lot of times. Biological waste management, this question was also asked yesterday. I suggest my students other questions also regarding medical portion. I want you should prepare those also. Especially I want them to prepare flail chest, chest pain management, that is very mandatory I can say. Then anemia topic, especially in pregnancy, and anemia in male female classification even. Then I prefer you should prepare your suturing material and techniques. I want this topic to be prepared by you. Chloroquine complete doses, a very important topic for all of you. Then types of bites, and you can prepare about the immunization schedule. The topics which I am giving you students, you will see in coming days, these will definitely be asked. After this, I will be discussing what my students have conveyed me about the interview. Then pain differential diagnosis and management. I want this topic to be prepared. Not yet asked, but I want that you should prepare this topic. Types of fracture, asthma, COPD. I want you should prepare vaccination schedule. Adenomyosis and types of fever, especially remittent fever, I want you should prepare. Main causes of fibroids, cholelithiasis, varicose veins. I want this topic from your side. Then one of my students has conveyed me, sir, they asked about frostbite, trench foot. I want this topic to be prepared by my students. And especially questions based on your own life. Like suppose your father is a teacher, they would ask you question, why don't you opted teaching as a career? Suppose somebody's father is in police career, then they can ask, if your father is in police department, why don't you opt police? Then certain other question based on your own lifestyle, like some are PZs and they are doing their taking their breaks in PZ, for PZ. They might be taking some leaves, or they might be taking certain years drop to go with their PZ. Then they can ask you, when you have taken a drop, then why don't you opt PZ? This question can be asked. Even they can ask that if you are going with, why don't you opt PZ? This is a common question for everybody. And other than this, you can prepare various other topics, like you can prepare pneumothorax, you can prepare mosquito bone all disease, I prefer. Then you can prepare stone burns, jaundice fever. I already told you. Try as not asked yet, but I feel as if this question is very important for all of you. Even the classification in antibiotics and NSAIDs, I want you should prepare. ECG changes in MI. Even MI related questions like types of MI and all these, MI related questions is definitely being asked, I have seen. Even I prefer you should prepare trauma, especially different types of trauma are there, you should prepare. You should prepare road traffic accident. This topic is mandatory, I can say. You must go through this topic. Then with your food adulteration topic, a very important topic for all of you, ascites. What is shifting dullness? They would ask you steps of percussion. I want my students to prepare about tuberculosis, even complete prescription, full doses of TB, secondary prevention of TB. I want this topic also to be prepared by all of you. Pneumothorax, aminoglycosides, this topic. And you can even talk about corticosteroid dose for lung maturation, betamethasone and dexamethasone. Then you can go with ACLS, BLS, intubation, hypovolemic shock, HAPE, typhoid, frostbite, malaria, important topics. Ectopic pregnancy, this topic is quite important, you should prepare. Cold chain, role of ASHA workers, Red Cross Society, Glasgow coma scale, this topic is very important. So I not yet asked, but I want this topic. Intubation, hypovolemic shock, snakebite, I already told you. Water purification strategy, this is a very important topic for all of you. Role of MO, again and again I am speaking, please prepare it in best manner. Everybody is knowing, but many of you are speaking in continuously. So I want in continuously, if you are able to speak for lot many points, that is the knowledge which you should show. Then you can prepare about carbon monoxide poisoning and types of insulins. They can ask about IVC filters, a very important topic. Even if I ask you differential diagnosis and management of pain, which I already told you, hydrocephalus, and what you learned during your interns, a very important question which my student would ask. He was asked in such a manner like, tell about your college life. So they can ask in different manners. You should have prepared best answer. See students, you should prepare personal and professional questions in best manner. Definitely get selected, believe me. And if medical is strong, your body language is good and your personality is good, they recruit, no worry at all. Measles vaccines, they are screening of CS cervix, classification of antibiotics and RF for CS cervix. Again and again I am repeating this question because lot many times are being asked this question, so prepare well. Suturing techniques I already told you. Even they ask you, this job is not a bed of roses, so what are your views about it? Why you opted Army, why you opted Air Force, why you opted Navy? And if you are preferred Army, Navy or Air Force, whatever you have preferred, they ask question based on that also. Then they can ask you about when any small child engulf a coin. This question is very common. So where it can stuck, that is cricopharynx junction. So you must remember this name. Even one of my students last year, he has got selected, Mr. Abhishek, Dr. Abhishek. He was asked about Horrocks apparatus. So prepare that topic, very important. Parkside formula, I prefer you should prepare causes of MI. Shoulder dislocation, a very important topic. Trench foot, already told you. Types of joints. Range of healthy BMI, low as well as extreme. And gland controlling BMR, eclampsia, preeclampsia, phimosis management. Then comes the paraphimosis management, phyllosis, career, difference between amoebic and pyogenic abscess. This topic is again very important. They can ask you about gram-negative organisms and Murphy signs, VVM, how to differentiate, how to differ cardiac and pleuritic pain. Then different heart sounds, especially murmur is very important for all of you. Dehydration management, waterborne disease, hypoglycemia already conveyed you. Calorie requirement in pregnancies, calories in daily food items, osteoarthritis, prescription especially. Even I prefer rheumatoid arthritis also should be prepared. DOTS, DOTS. Seizures with fever, differential diagnosis, mid-diastolic murmur disease, surgical instrument sterilization, surgeon material, head injury management, and nail changes, especially colors in different diseases. What is foregut, midgut, and hindgut. Kuchenberg's tumor and CKD stages, donning and doffing, lower limb ulcer, TB diagnosis, X-ray findings, management, corticosteroids, complications. Then Stevens-Johnson syndrome. What type of endoscopy you use if child swallows a nail or battery? Ethambutol, UTI bleedings, upper GI, and hypertension diagnosis, causes of increased JVP. Students, other than this, I preferred what my students have stated, that they first check what type of personality you are. Personality related questions are almost 30 to 40%, not more than this. Sometimes they directly ask you medical questions, so you should be well prepared about this also. If they ask you directly medical questions, then also you should be ready to answer. And show your body language the best possible manner, go with gentle care and speak as if that you are very confident in speaking. Many students are asking me, sir, can we speak totally in Hindi? I prefer no, not at all. You should speak in Hindi and English both. Try to use as many English words you can, especially HR based answers like your hobbies, your strengths and all that. Prepare, tell about your strengths in such a manner as if these strengths are yours. They can even say prove your strength. This is a very common question by AMC. And even they ask definitely, why should we select you? Why do you want to join Armed Medical Corps? These questions I want you should prepare in advance, and prepare well, as if that you can speak in such a manner that you are speaking in a natural manner, not as if you are crammed somewhere. ऐसा मत बोलना. Other than that, you prepare with your looks, especially the outer grooming. Your dress up should be nice. Then your inner grooming, the way you speak, you start, you respect the interviewers. When they interrupt you in between, you show your wit to answer them also, and covering again your answer. That is very important. Is different way I can say. You should develop these guts. Give lot many times mock interview sessions to, especially to right mentors. That helps you a lot, and I hope that you will definitely crack this interview. Still any question is remained in your mind, you can ask me, but whatever questions I have given you today, prepare those questions. It will definitely be fruitful to you. So my best wishes to you. Thank you so much for watching and enjoying our videos. Thank you.